The Trust for America's Health projects that all states could reach or exceed an obesity rate of 44% in adults in 20 years, and the researchers estimate that the projected increase in obesity rates will cost the United States $550 billion between now and 2030. What policies, if any, do you believe the government should adopt to prevent rising healthcare costs caused by obesity-related diseases?
Well, I honestly think this is a place that the government should probably keep their big nose out. I don't think the government needs to be telling people what they should eat or what they should drink. I think that I understand it's a struggle. I'm a woman in her 50s. I've got 7 sizes of clothes in my closet. I go from one end to the other. I think encouraging, trying to set a good example, you know, speaking out about it, like Michelle Obama has done, how important it is for our kids to move, considering the importance of physical activity for our children in K through 12, making sure that we support and promote that in ways that are advisory only and not requirement, and also paying for prevention, making sure that people can go see their doctors and learn about the dangers of diabetes before they develop the adult onset of diabetes. You know, if we can bring down diabetes in our adult population by just 10%, it is amazing what it does to the cost curve of our debt and deficit. So this is an important issue, but I would not be someone who thinks the government should get in the business of telling people what they should eat or drink.
Jonathan Dye.
The top 5 leading causes of death are all related to diet and lifestyle. Heart disease is actually the #1 cause of death in America. They're all preventable. Diet and exercise is something that can really make a big difference. I've been a personal trainer for 15 years. I help people motivate themselves to get out, get in shape, build muscle, and burn fat. It's something that anybody can do at any age, but somebody needs to be a role model. I think the government should make incentives, whether they be tax incentives, making gym memberships tax deductible, or personal trainers, but it is the #1 drain on our healthcare system overall. I think we do need to have some positive reinforcement instead of negative reinforcement like the government is so used to. Obesity does kill more people than war, murder, crime, drugs, and everything else combined. So if that's not a problem where the government should set a role model, I don't know what is.
Todd Aiken.
You know, all of us have things in our lives that are challenging. And for some people, obesity is one of them, but there are a lot of other things. And all of us are people. And all of us have to try to manage those things and try to do the best we can in the circumstances. But when the government starts to overstep and there's problems with jobs and all kinds of stresses, these problems then become a lot worse. And I agree, this is the first time I've agreed with Claire, this isn't something the federal government should do. Now, the federal government's telling you what kind of light bulb to buy, how much water can come out of your shower, how much water can go down your toilet. You can't have any dust in the combine. I'm glad there's something that the federal government doesn't have to do and tell you what size drink cup that you're going to have. And, but I think that this is part of just being Americans. This is part of basically living the dream in America, that we can challenge ourselves and to try, stumble and fall sometimes, get back up again and try some more. But I think we also have to have a love for each other, because we're all Americans. We're all God's children. And we need to give people a hand when they need it, or some encouragement when they need it. And so this is one of a whole series of things that I've kind of put in the category of self-government, the way that we run our own lives responsibly. And this is what's made America strong, is the fact that we're good at doing that here in America.